For decades, the way we fought cancer has been, well, a war, a real battle of brute force. We cut it out, we burn it with radiation, we poison it with chemo. But what if we've been asking the totally wrong question all this time? What if the goal isn't just to kill cancer, but to outsmart it, to reprogram it, and maybe, just maybe, to simply turn it off? That's the incredible new frontier we're going to explore. So here's how we're going to break it down. First, we're going to reframe the whole problem. We'll stop looking at cancer like a monster and start seeing it as a bug in our biological software. Then, we'll dive into the amazing new tools scientists are building to fix that bug. After that, we got to have a necessary reality check. Where does this science actually stand today? And finally, we'll look ahead and ask, what does all of this mean for the future of treatment? Okay, so let's be clear. The traditional methods, surgery, radiation, chemo, they save lives every single day. There's absolutely no questioning that. But they work on this kind of scorched earth principle, right? They often cause just immense collateral damage to the body. The cost for the patient can be, well, it can be huge. So that brings us to this one question that is changing everything. It's shifting the entire goal away from this war of destruction to a mission of control. It's all about finding that internal switch and just flipping it from malignant back to normal or, hey, even just harmless. And this right here is the heart of the whole paradigm shift. We're moving away from those physical acts of destruction, and we're starting to use a whole new vocabulary. Words like correct, silence, disable. It's a massive change, really. We're going from being an executioner to being more like a programmer, a bioengineer, fixing a critical error from the inside out.
So if we're going to talk about reprogramming cancer, first we have to really understand what it is. And it's not just a lump of cells, right? It's a process that's gone haywire. The best way to think about it is like a glitch, a bug in the most complex operating system you can imagine, the human body.
I mean, think about it. Every single one of your cells is running on this biological software. Your DNA is basically the code. It's the complete instruction manual for life, telling each cell what to do, when to do it, and, this is the really crucial part, when to stop. It literally dictates the entire life cycle of every cell.
And that's exactly how cancer works. It's a bug. A series of mutations corrupts the code. Suddenly, the stop growing command gets deleted. A nasty little subroutine that says hide from the immune system gets activated. The cell just starts ignoring all the body's rules and follows only one thing, its own broken malignant programming.
Okay, so if cancer is a bug in the code, well, the good news is that scientists are now building the debugging tools to fix it. So let's check out 4 of the most promising approaches that are, no joke, fundamentally changing the entire game. All right, first up, epigenetics. Now, here's a great way to think about it. If your DNA is the actual text in a book, then epigenetics is all the stuff around the text. The highlighter marks, the sticky notes, the folded down corners. It's all the things that tell you which parts of the book to pay attention to. It doesn't actually change the words, but it completely changes how they're read and used. So in cancer, you've got the wrong genes getting highlighted. The genes that are supposed to suppress tumors, they get switched off. And what epigenetic drugs are designed to do is reverse that. They essentially wipe away those bad highlights and turn the body's natural cancer-fighting genes back on. It's just powerful proof that cancer can be controlled or modulated, not just flat-out attacked. Okay, our second tool. This one sounds like it's straight out of science fiction. We're talking about nanodots. Get this. In lab studies, these tiny microscopic particles can take out cancer cells up to 3 times faster than healthy cells. What they do is they sneak into the tumors and they just nudge the cell's internal stress level a tiny bit higher, just enough to push it into its pre-programmed self-destruct sequence. It's called apoptosis. You're basically convincing the cancer to kill itself. But okay, we have to be realistic here. This tech is still really early. We're talking preclinical stages. And researchers are wrestling with some major questions. Like, how do you make absolutely sure these nanodots only go to the tumor and nowhere else? What are the long-term effects of them being in the body? I mean, it's an incredibly powerful idea, but the safety and the delivery systems, they have to be perfect. Now, the third tool takes a completely different angle. Instead of trying to reprogram the cancer cell, what if we could reprogram our own immune system to do the job for us? And that is the incredible idea behind something called CAR T therapy. People are calling these living drugs. The process here is it's remarkable. So doctors take out a patient's own T cells. These are your immune system's soldiers. Then, in a lab, they genetically engineer them. They basically give them a new mission to recognize a specific target on that patient's cancer cells. They grow an entire army of these new super soldiers and then infuse them back into the patient. And just like that, they become living, breathing, guided missiles that hunt down and destroy the cancer. And that brings us to our final tool, and it's the big one, CRISPR. You've probably heard of it. It's basically the ultimate genetic edit button. And for cancer, it's being used in two main ways. The first strategy is to use it to supercharge those immune cells we just talked about, making them even better fighters. But the second strategy, well, that's kind of the holy grail here. It's using CRISPR to go directly into the tumor's DNA and correct the bug right at the source, to silence the exact genes that are driving the cancer in the first place.
Okay, this all sounds absolutely incredible, right? And it is. But now we have to pull back a little and ground ourselves in the present. With all this amazing science happening, what does treatment actually look like for a patient walking into a hospital today? Well, the reality is this. These new reprogramming tools are, for the most part, used as adjuncts. That means they're used in addition to the classic treatments, not instead of them. For the vast majority of patients, the foundation of care is still surgery, radiation, and chemotherapy. So we're definitely not throwing out the old playbook, not yet. So let's do a quick status check. Where do things actually stand? Epigenetic drugs and CAR T therapy, they're approved, and they are saving lives, which is amazing, but it's mostly for certain types of blood cancers. Nanodots, still in the lab, so preclinical. And CRISPR, that's just now getting into early human trials. It just goes to show you there is a long, long road from a brilliant idea to a standard everyday treatment. But even with that reality check, it is absolutely impossible to overstate how important this shift is. This isn't just about a few new tools. It's about a completely new way of thinking about the disease itself. You know, for the better part of a century, the goal was just annihilation. Destroy everything. And we just hoped the patient would survive the crossfire. But now, the goal is precision. It's about finding the one single broken component and fixing it with as little collateral damage as possible. What this all means is that we're moving from monster hunting to linguistics. We're finally learning to read the language of cancer, to see the typos and the grammatical errors in its DNA. And more importantly, we're learning how to become the editors, how to actually rewrite that story. And that leaves us with the ultimate question, the one that's going to drive the future. We know it's possible to turn cancer off. The new challenge is making it personal. How can we tailor these amazing reprogramming tools to each individual person, to their unique cancer, to find their specific off switch? Answering that question, well, that's what's going to define the entire next generation of cancer medicine.